Hi, everyone, and welcome back. We're going to talk about functional communication training in this video. Functional communication training is a derivative of differential reinforcement of alternative behavior. So, the DRA, which is when you differentially reinforce a behavior which meets the same function as the problem behavior. And FCT, functional communication training, is essentially that if you are reinforcing a way of communicating. It is differentially reinforcing a communication strategy for the person that will gain the same function as the problem behavior. We're going to define it pretty well so you can fully understand it. We're going to understand why we use it. This FCT is used between 50 and 70% of your job should be a lot of FCT. Helping people find ways to communicate their wants and needs is our bread and butter. It's what we do. And this is hugely important for that. There are individuals who have limited communication, and you might be using PECs, might be using alternative communication devices. You're still doing this using those methods that they're comfortable or able to communicate with. So it's used when problem behaviors serve a communicative function, which I would argue all problem behavior does, to provide a socially appropriate way to get the same outcome. So you're going to identify how do you select an appropriate communication response. The new communication behavior should be functionally equivalent, efficient, recognizable, and match the learner's abilities. And you're going to learn steps to implement and maintain FCT effectively. Steps include a functional assessment, teaching new responses, using reinforcement strategies, and maintaining the skill over time. It's a research-backed procedure that replaces challenging behaviors with functional communication responses. The goal of FCT is to teach individuals a socially appropriate way to communicate their needs and desires, ultimately improving independence, quality of life, and safety. So if you look at an individual engaging in a lot of problem behavior, it's all communication. They're communicating something that they want and need. A huge part of our job is to help them find a socially appropriate way that everybody can understand. Even if they go into an environment with an untrained person, just another caregiver, their mom's friend, a teacher, an aide, they can engage in some sort of communication behavior which will get them what they want and need. When problem behavior often serves a communicative function, I would say it always does, such as gaining attention, escaping demands, or accessing preferred items. Even when, you don't want to work with pain attenuation behaviors, you want to have them go to the doctor and get help for those, medical help. But even sensory behaviors, even though you're not going to, you can't exactly meet the same function, you can have them say something that will give them that sensory break where they can engage in those sensory behaviors in a safe setting. So, if their sensory behaviors are distracting the whole class, they can say like, can I go to the library, read a book, and engage in my sensory behaviors? They wouldn't say engage in my sensory behaviors, but something along the lines, I need a break, or I need quiet time, or I need sensory time. And so you can do this with anything that they're engaging in behavior to access. You can find a way for them to communicate. I need this right now. Can I get it? Evidence-based approach, it has decades of research. It's been shown to effectively reduce problem behaviors while teaching functional communication skills. It provides a way for someone to meet the same need or function in a more socially acceptable manner, improving their independence and quality of life. And honestly, I encourage techs or people working in the field to utilize FCT over other DRAs. So though DRAs, for example, if someone is hitting for attention, maybe they give a hug for attention. Now, that give a hug is an interesting behavior because it's not going to work with everyone. There's inappropriate times to request a hug or try to give a hug, but you could give them a list of ways to gain attention and they could ask for that or even just ask, look at me right now. That communication is gonna be better for more environments. Typically, FCT will generalize better to environments than just a DRA most of the time, improve safety. So by replacing challenging behaviors with appropriate communication, FCT helps create a safer environment for both the individual and everybody around them. So to do this, you have to know what the function of the behavior is, and to do that, you need a functional assessment or a functional analysis. So it's, going back a little bit to our assessment section, this is a comprehensive process to determine the function of the behavior. It will identify the function of a problem behavior, such as gaining attention, escaping a demand, accessing preferred items, or sensory stimulation. You want your baseline during this as well. To find that function, we often use ABC data collection. And we develop a hypothesis about the function. A lot of times we might do a functional analysis to verify that hypothesis. So at the end of that, you know what your most likely function is. From there, you can create an FCT plan. But you need that function to make FCT work. You have to select a response that has to match the learner's ability. If they're not speaking, it can't be a speaking response. These things should not be difficult. They should not be difficult for someone to engage in it. If have like speech emerging, you wouldn't give them like a full sentence because their speech is emerging. There's gonna be a lot of work just to get 2 sentences. We want these to work immediately. So it has to be functionally equivalent, efficient, recognizable by you as well as other people. So you always want to think if like mom's friend or caregiver's friend would also know what this means. Would peers know what this means? And you want to match their ability, whatever their communication ability is at the time, whatever they're using as far as devices go, whatever's most comfortable to them or they use the most, that's what you want to do. This is to develop communication responses to meet the function. Primarily, we want to meet the function. So example of FCT replacement responses, they're hitting staff and the function is escape. They would say, break, please. They could have a card, just something easy that they could communicate, I need a break. And so what you're hoping is if we reinforce that break, please, they're not going to hit stop. You want your response with all DRs, you want your response, what your replacement behavior to be less work than the problem behavior. So pulling a break card is a lot less work than hitting. They're screaming for candy, so that's access to a tangible. And so pointing to a candy pitcher would be a FCT response. They're flopping to the floor to escape hard worksheets, a reading assignment, just something. Pressing help on their assisted communication device would be alternative response. It could also be break. It really depends. Escape is nice, but it's nice to know more about that escape behavior. Is this something that they can't do? If it's something that they can't do, then providing help might be a viable option. But if they can do it, but they just don't want to in that moment, or maybe they're in sensory overload or something, then you want to give them that break. Interrupting repeatedly, so they continually interrupt, that's clearly for attention. Tapping the excuse me button to get somebody's attention. Grabbing toys from peers, that's clearly access to tangible. Sometimes with behaviors, you don't need to do much of an FBA to know what the function is, even though grabbing toys from peers can also be attention. Requesting my turn with a picture, so they point to a picture, my turn, so that they can get access to that tangible. When you teach, you want to prompt it, use those verbal, physical, or model prompts to help the learner perform the new communication behavior. Provide the least amount of support needed, so least to most prompting or a time delay is always best. Reinforcing the communication response. So immediately reinforcing the learner each time they use the new communication response, such as a praise, a preferred item, or access to a desired activity. You should get natural as well as kind of extra with it, like whether that's praise or whatnot. And again, that goes back to the problem behavior gets the natural. So if they're interrupting, they get attention. Now, if they ask appropriately for attention, they should get attention plus more. That means they'll really want to engage in that replacement behavior, the FCT, rather than the problem behavior. When the learner engages in the problem behavior, block or redirect them and prompt the use of communication response instead. So, blocking. It's not my favorite. It is part of this FCT, but you don't necessarily need it. You can still do FCT without it. Over time, gradually fade prompts so they become more independent using the communication response. When you reinforce, immediately reinforce the new response at first. Every single time they engage in that response, you reinforce it. Then you want to thin that schedule. You'll go from a continuous reinforcement to one of those other 4 schedules I talked about, and you're going to reduce the amount of reinforcement they get. So they have to engage in the behavior a certain amount of times to gain reinforcement, or you could use a time schedule. Choosing those schedules don't depend on like you or which one. There's not like this one's always best. It's very based on the individual and the behavior you're working with. Reinforce only appropriate communication behavior, not the problem behavior. Diverse needs are people who can't speak or their speech is emerging and we're not really fluent yet. So there's lots of ways that we can communicate without using just traditional speaking or speech. So picture exchange communication system is a visual communication system that allows individuals to communicate by exchanging picture cards. Now PEX is on iPads, and so it's a lot easier. We used to make so much of that. It's a lot easier because the iPad does a lot of the work for you. A lot of the people who have been in this field a long time, you could ask them about it and how hard that was. Communication boards. So there's different ways. There's some packaged ones. It depends on the person. Some people have strong preferences for something or the other. I always go with preference for this. Proloquo 2 Go is a generated speech output. So it's a device that they pick. I think you can pick letters or pictures on that one, and it will say it to the person. What I found with choosing this stuff, it needs to be in consultation with a speech therapist. They do entire classes on this, right? We don't get as much training. We get some. And sometimes a supervisor, if they've worked a lot with this, might have enough experience. What I've always seen done is if we are expecting speech at some point, it's emerging and coming, we might use PECs. If we are not expecting speech, it's just delayed, we go to Proloquo 2 Go, or we go to an AAC device. And that's going to be how they're going to talk probably for a lot of their life. It depends on a couple things. You always want to make sure the right people are consulting on this, like what to use. So I don't see a lot of this with adults who aren't, deaf or hard of hearing. What happens with this is when a child has delayed language, the parents might teach sign, which is great. There's baby sign and then there's American sign. There's a lot of different sign language options. Because they might take to that and start using a lot of sign. Parents tend to dislike this because they think it replaces the speaking. I've seen some older kids who are really fluent in sign, despite not being deaf or hard of hearing, and it works pretty well for the environment. But this is a caregiver, school, everyone has to be involved in this. You're going to see some little kids using sign because it's very easy to teach. You don't need a device. You don't need pictures. We just need our hands to do it. And so parents looked up some sign language and started teaching them. And so that's just working with everybody to figure out if we're going to continually have sign language as their main mode of communication, or are we moving to something else? How close are we to speech emerging? Vocal approximations, a lot of that will be part of a lot of your learners' communication at some point. As the speech emerges, that's what you start with, approximations. Visuals, there's different things like sign, picture symbols, iPads, sign gestures. Like sometimes we're mixing a couple of these for communication. Again, consultation with speech is hugely important, involving all stakeholders and like more so than some other stuff because the stakeholders are the ones who are going to see whatever is done and then respond to it. So they have to, if someone's going to use sign language, most caregivers have to be fluent in that or this isn't going to work. So you really need to make sure that you're working with everybody or make sure your supervisor's working with everyone. You'll probably be told what's going to be used, and you could if you see something and you think that's not working, you could state that to your supervisor. But just making sure a lot of people are involved in the communication strategy decisions. Joey engages in aggression when denied access to his iPad. His behavior is tangible maintained. So it's access to a tangible through an FBA. In response, when they're engaging in aggression whenever the iPad's taken away, that's my first guess. You want to do a little bit more because that could be attention and that could be escape from whatever they're trying to move him to. Like, oh, no more iPad, let's go clean our room. And that might be escape. So that's why you still have to do the FBA, even though your first kind of thought when you're watching this, when the iPad's taken away, he engages in aggression would be access to iPad. So Joey is taught to hand over My Turn card to request iPad access, which serves the same function as his aggressive behavior. So again, you would start with that. You would reinforce that. Initially, he's going to get a lot of iPad time. That can be something you need to work through with stakeholders. But once we've developed that behavior to ask for turns, then we can maybe fade the iPad a little bit to whatever, he's going to get through the next few years as far as iPad use goes. Common mistakes: teaching a response that is too complex. So avoid teaching the individual communication responses overly complicated or beyond their current abilities or with a communication device they're not used to. So if you're going to do FCT, they need to be embedded in whatever communication strategies they're currently using. We have ways to build them without touching problem behavior yet. So we can start developing them and having the students or the learners get used to them without replacing the problem behavior. They have to be comfortable with it before we start working with the problem behavior and what they want access to. Reinforcing the problem behavior and the communication behavior that happens is supposed to be on full extinction. You want to not reinforce problem behavior anymore so that replacement behavior does increase. Ignoring the function or being wrong about the function and then failing to generalize to different settings or people is a huge one. Everybody has to understand when the person does it, and that if it's sign, that's what's kind of hard about sign. It's like if they're in the community and ask for something, will someone understand? If you're going to use sign, everybody who might care needs to understand all their sign language. You want to track the frequency of problem behavior, so you want to monitor it, and then you also want to track the frequency of the communication response. This is something that I didn't talk a lot about, but you want to baseline your differential reinforcement early on in the FBA process. So if you're that kid with the iPad who's engaging in aggressive behavior to get access to a tangible, so you're like, okay, good, we know the function. And their replacement behavior is asking for a turn, you're going to take frequency on asking for a turn. How often do they engage in replacement behavior rather than the problem behavior? You need the baseline of your replacement behavior too. And the best replacement behaviors, whether it's FCT or you're using the other differential reinforcement, is one that already occurs sometimes. It's just not occurring because the person knows how to do it. Teaching a brand new behavior is harder than working with a behavior they know. So if he already asked, my turn with the iPad, a lot of times with these aggression to get a tangible, they'll start with just asking for it. But that doesn't get the behavior, so they move to aggression. If he's already going, my turn with the iPad, That's great. We know he knows how to do that. So now we're going to just give him the iPad when he says that. So that behavior will become stronger. But that's why you have to take baseline. You should take baseline because once you move to intervention, you want to make sure that replacement behavior or the FCT is going up. Note whether the communication response was independent or required prompting, and then track reinforcement delivery. You want to make sure they're getting reinforced. So it's really important to track how often that's happening. Graphs are always best to monitor progress. It helps us visualize what we're doing and make decisions. So here's a example of implementation. We use physical and verbal model prompts. We provide the reinforcement immediately, redirect problem behavior, gradually reduce prompts to increase independence, and then thin that schedule out from continuous reinforcement to some sort of variable reinforcement or just a thinner schedule. Reinforce the appropriate communication, not the problem behavior. FCT is basically DRA, but it has to be a communication response, not just anything, any behavior. So, and again, FCT is always DRA, always, but DRAs are not always FCT. So it's kind of like under the umbrella of DRA, but there's other things that are DRA that aren't communication. Understand when and why it was used for a socially appropriate way to get the same outcome of their problem behavior. New communication behaviors should be functionally equivalent, efficient, recognizable, and matched with the ability and their preferred communication strategies. Use prompting, immediately reinforce the communication response, block or redirect the problem behavior, and gradually fade the prompts out, and then thin the schedule.